know that people have very strong feelings on this subject, but I hope we all understand that we as MEPs are here to get the best possible regulation of these products, not to ban them, as is going around a lot on the internet.
They were first marketed in 2004. They are battery powdered, and they often are offered with flavors just to favor the consumption among adolescents and other groups.
There was a request from MEP to hear some users, and we chose the Users Association from Germany because they have the most users of these cigarettes at the moment. So that's what we're going to do.
E-cigarettes are means for enjoyment and stimulation, very similar to a cup of coffee, and exist due to their freedom of availability, taste, and big variety of flavors.
I've read lots of other things, that we have an unholy alliance between myself and the tobacco industry. People who know me might think twice about that comment, and also the pharmaceutical industry.
The only company that has an e-cigarette approved by the MHRA for clinical trials today, you know who it is? ETC and Creative, owned by BAT, by British American Tobacco. So if you regulate this as a medicinal product, the consequence will be that you will hand the whole business over to the tobacco companies.
We therefore believe that subjecting electronic cigarettes above a certain threshold to marketing authorization under the pharmaceutical legislation is an appropriate solution.
E-cigarette is not curing anything, but rather replacing approved harmful addiction with far less dangerous enjoyment. An easy understandable example, imagine to replace coffee with tea in case you have a weak stomach.
Also, I may be cynical, but even salt can be looked as and viewed as a medicinal product because salt can reduce high blood pressure. Are we going to regulate salt as well?
Our fear is that there is a time delay in health consequences. Just like with cigarettes, it might take decades before we see the health damage.
My name is Jean-François Etter. I'm a professor of public health at the University of Geneva. With Ricardo Polosa, I think I'm among the few people in this room who actually conducted research on electronic cigarettes for several years. And I must tell you that the science of electronic cigarettes has not been fairly represented here today. A number of things have been said that have no scientific basis at all.
In 8 out of 10 cases, people report negative symptoms. When it comes to symptoms from the cardiovascular system, a large majority reported negative symptoms from the chest.
You cannot represent science by just cherry-picking the negative studies and presenting this as science. It's not fair.
We cannot continue to subject different nicotine replacement therapies to different regulatory regimes. Currently, we have some products like patches, sprays and chewing gums, others which contain exactly the same active substance, just in a different form of delivery, regulated in a completely different way. So this is clearly not a level playing field. I firmly believe that the pharmaceutical legislation is a good regulatory framework for e-cigarettes and would also ensure that these products do not develop into an entry gate for nicotine addiction for young people.
Eating tobacco is as dangerous as drinking e-liquids. Nicotine can be synthesized as well and will be the same substance. Or to put it in a picture, Coca-Cola is not coffee.
This workshop has been organised to listen to people so that MEPs can come to their own view.
I really wonder, it's not rhetorical, why such a huge discrepancies between your picture and the one that we catch, not from the industry, the one that we catch, most of us catch from our relations, our contacts with the consumers, with the users, with les vapoteurs en français, with the vapors or whatever in English, I don't know.
My question is, though, we all want to see e-cigarettes used to prevent smoking, to help people quit. But if it is a smoking cessation product, why can it not be regulated in the same way?
With e-cigarettes, you have something that can make a difference. I've worked in this field for 20 years. I think it can make a difference. If you regulate it as a medication, this will profit the pharma industry, who doesn't want a competitor, big tobacco, who are the only ones who can actually comply, and eliminate all other nicotine suppliers.
Tobacco kills one addict out of 2. That's the figure, it's not politics.
From the users who have spoken to me, they do not stop their nicotine habit, they stop smoking and they switch to an e-cigarette.
E-cigarettes are nothing less than an alternative to the tobacco cigarette.
I fear that if they are regulated as medicinal products, they will not be available as widely as possible, and the result is that thousands of people will die.
Like